all the medication? Oh, actually, because I wanted to talk about the pediatricians and psychologists. So pediatricians, their clinical guideline is that the doctors should determine whether a patient's symptoms are in line with the definition of ADHD in the DSM. And for this, it requires days or weeks of sessions and work with this person, and they need to get like references and interview teachers, the parents, the actual child, and this needs to happen over and over, and they need to observe them in how in like their different environments. But this doesn't really happen. Instead, about 1/3 of a visit to the doctor lasts them less than 10 minutes. And then for the specific purpose of going into your doctor for a psychosocial evaluation is around 20 minutes. So these children are being diagnosed probably by them not even really answering. It's their parents going, oh yeah, that's my kid. They get up and run around at the table. Yeah, they don't listen to me all the time. They daydream a lot. I'll ask them to, or their teacher will be like, I asked them to do this and they were trying to play with the toys again. And so I think that this was like a huge problem. Like, we can't even give them the proper amount of time to diagnose them. And then I had read a study where vignettes of different cases were sent to multiple psychologists, like all over the U.S. And these vignettes, some were actual cases of ADHD and some weren't. And the ones that actually had that weren't cases of ADHD, 16.7% of the doctors gave a positive diagnosis of ADHD. And out of those that frequently diagnosed ADHD, medication was recommended 33.3% of the time, and psychotherapeutic treatment was recommended 92.6% of the time. And I think that this is a problem only because, like, again, people are going to be medicated that don't need to be medicated. And I think when you're going to therapy at such a young age and the stigma that comes along with therapy just causes more problems for the child, because they're like, oh, I must be crazy. Like, I've been going to therapy for this long, and like the stigma just keeps getting like worse and worse as they grow up. Because I mean, even if like in my psychology classes, like we talk about who's been to therapy, and no one will raise their hand. There's actually very few that do, and because that stigma is still so strong. And in psychology, like they tell you to go. You might get extra credit for going to therapy, so you know some people are going. But still, there's this stigma, and I think when you're 5 to 7 or 7 to 12 that are going to therapy, and like you don't want to talk about it with your friends. That's not something you shared. Like your friends will see you as crazy, or there's something wrong with you, and so I think people are really scared to show this. And this misdiagnosing, I think, hurts people in the long run, like overall, whether it be medication or actually going to therapy. The medication, this is just some of the medication that's prescribed. And like I said, okay, so Drug Enforcement Administration classifies stimulants as Schedule II drugs. Schedule II drugs are having high potential for abuse, and with use potentially leading to severe psychological or physical dependence. The drugs that are on here that are part of this Schedule II list is Ritalin, Adderall, Vimizine, and Concerta. And what also belongs to Schedule II drugs, cocaine, methamphetamine, Demerol, and Oxytocin, or Oxycontin, excuse me. And like, if you know anything about this, is all bad. Like, we're putting kids on this at the age of 7, and it just becomes an addiction. And the more you take a drug, the more your body like gets used to it and it adapts, and then you'll need a higher dosage and a higher dosage. Last week, I had a someone that works in the public sector come in to talk in my psychopathology class. The main people that she sees out on the streets, and she worked outreach to kind of bring them in and try to at least get them clean needles or something. People with ADHD that have been diagnosed, you get cut off of your parents' healthcare plan at a certain point. It's probably going to happen to most of us soon if it hasn't happened already. And so what these people do is they go get methamphetamines off the street. They are going to go get cocaine, so that because like I said, the medication has to be tinkered with. There's no exact medication for each case, and it's trial and error. Do you want to mess with your body taking these things, or with your kid's body and taking these things and having them figure out, oh no, that was too high, that doesn't work, it totally shuts you down, or that's too little, it just raises up how hyper you are. We don't know the long-term effects of all the medication, other than that it can be addicting, and for many it is. Or they don't learn how to function without the medication. There's no weaning off of the medication for the most part. It's like these people have it, and they have it while they're young, and it's consistent. And all of a sudden it's cut off when they get to a certain age, because it's too expensive to buy without insurance. These people just, there's no outlet, there's no way that they're being weaned off, or they're being shown that there's a different way to be able to handle ADHD. We don't know exactly what it is we're doing to our children. The medication, in an article that I read that talks about the drugging of the American boy, because for the most part boys are 2 times more likely to be diagnosed with ADHD than girls. 1 out of 7 boys in America are going to be diagnosed with ADHD. This changes to 1 in 5 by the time boys reach high school. And so we don't know exactly what it's doing. We don't know exactly which parts of the brain it's affecting. We don't know how it's going to, how much dosage your body can actually take until something bad happens. The medication, it's reactive instead of preventive when it comes to symptoms, I guess. And the people that are diagnosed at a young age, about 70% of them will have seen that through the rest of their life, that I guess actually have it. So what happened to that 30% of people that's been taking drugs for however long before whatever age it hits between when they're finally seen as adults? And I think that's the biggest problem here, is that we really need to look at what it is we're doing to people. And these are my references. And if you have any questions.
Does ADHD get anything like Asperger's syndrome?
I didn't really look into that, but I think that there's parts of it that coincide, because I did see where ADHD is linked to other what are seen as disorders, and Asperger's is kind of seen as a disorder. So it depends, I guess, on
Is Asperger's still in the DSM-5? Because there was some talk about taking it out, and that they were just going to call it spectrum.
I wasn't sure, but I just saw Asperger's referenced in a couple of articles I looked at, but I didn't look into it more yet.
That's interesting.
I have seen some long-term effect studies of those medications. I don't know if they're valid enough to be used in textbooks and stuff, but I've seen that they've been prescribing these since the 80s, and they've seen that kids, their growth gets stunted and their liver is damaged, and those are some negative effects.
Yeah, that's what I saw too. I think it was only in one article, so I wasn't sure if I should use it or not. But yeah, they definitely talk about stunted growth and the liver. I did see about that. But it's they lose track. Some are longitudinal studies, but they lose track of them once they lose their health care.
Okay.
And so the public health worker that I met said that the majority of what she sees on the streets are people that actually were on Ritalin or were on Adderall, and now they're on something a lot heavier, because they can't go buy those prescription drugs anymore because they're just cut off.
Do you see that the potential for that area of research in particular shifting because of the Affordable Care Act? So the likelihood that folks are going to have a little easier access once they're no longer on their folks' insurance?
I'm hoping so, but I think it's going to take a long time for that to actually happen, because I think we have to look at this as healthcare as public healthcare and what exactly that includes. And so I think some of these people that are diagnosed with ADHD, they don't need any kind of medication at all. What they need is to or maybe just to give time for them to actually develop and grow as a person, because like I said, I think 7 is way too young to diagnose someone with ADHD.
And did you see any, in any of the articles, discussions around nutrition or how that may be impacting?
Well, they said that there's a lot of
Managing.
looks at that, like the belief is that a lot of sugar and whatever's in the food today is what's having an effect on ADHD, but then there's a lot of people that are against it. Just like the very beginning of the very beginning with that video and how all the different views, that's really what the research looks like. And there's not a lot of things that are like set in stone or like accepted. Except I saw genes as being part of it. But
So
but it
actually
didn't
within
exactly
your
say
idea.
exactly what genes it is. I think genes is kind of something that psychologists go to when you just want to explain something but don't know the exact answer.
So it's really up in the air.
Yeah, I think it's really up in the air, and what scares me about it is that it's so like prevalent in being diagnosed. Like the statistics on how fast diagnosing ADHD is growing,
Uh-huh.
I think is really should be really worrisome.
And then the other thing, just curiosity now, the link to, did any links to the increase in access to easy technology?
They just talked about it on how we
But
have
not
things
as a
that-
direct.
but not as a direct
I
correlation.
just wondered.
Yeah.
Sure, go ahead.
Did you, were you able to see like, a difference or a correlation or anything that stands out between children who are diagnosed who are, African Americans and then children who are diagnosed that are, maybe other than African American?
Actually, I think it's on one of these. I think it's the CDC, the data and statistics. It does break it down by race, and I think that I can't remember who's actually on top, because there's also like a thought that maybe it's like who gets diagnosed is more of a class thing as well.
Interesting.
And so it was something I'm looking at, but I didn't have time to look at it for the presentation.
And did you see any success stories with, children who are diagnosed and do come out okay with treatment and medicine?
A lot are actually in creative fields, which was I
Right.
thought was really interesting. A lot of directors, in the TED Talk, he talks about Robin Williams, and he's our poster child, which I thought was pretty funny, but at the same time kind of sad, knowing that he was majorly depressed, and again, he was on medication at the time, so like you wonder if that has an effect, and if that just causes more mental issues.
It's interesting that you're talking about like getting cut off like at a certain age, because I was wondering if those kids that are medicated, if there's more of a chance of them getting into like drugs, like hardcore drugs. Because I know, I mean, I have several friends or people that I knew like in high school that now that I think about it, they were ADD, ADHD, on Adderall, Ritalin, and then all of a sudden, like after high school, it seemed like at that time they started going into like more street drugs, things
Yeah.
like heroin, actually.
Yeah, it's actually that seems to be the transition that they get cut off. A study from Michigan State found that Adderall is most commonly used in high school seniors, and I think like in high school you're with your parents. I'm not feeling well. This is what my problems are. It's easy to get script. I think when you go to college, you're like there's more of a chance for you to learn how to self-medicate. And maybe because your parents are like, no, if you want the Adderall or the Ritalin, like you go to the place and go get it yourself. And if you're having to take care of yourself and like provide all that stuff for you, and there's something that your friend's like, oh, this guy I know, and he'll give you a lot, and you don't have to worry about going in and getting a script and having to keep up with going to like therapy sessions or check-ins with a psychiatrist or a psychologist, then it just makes it a lot easier. So I think part of it, like part of these medications that are given are gateway drugs into harder stuff,
Yeah.
Interesting.
because